detail, but there are several different classes of cholesterol medicines that are within our armamentarium. But a lot of people are very resistant to cholesterol medicines, and it's kind of what's popular in the culture today. 2000 BC, people said, I have an earache. Here, eat this root. 1,000 years later, this root is heathen. Say this prayer. In 1850 AD, that prayer is superstition. Drink this potion. Later, it became that potion is snake oil. Swallow this pill. Then we started realizing this pill is ineffective. Take this antibiotic. And now it says the antibiotic is artificial. Eat this root. But I'd like to point out that these statins, which are really our most commonly used class of medications that a lot of people like to complain about because they cause muscle aches and there's reports of liver problems, are the #1 medicine we have that's been proven to reduce heart attacks and strokes. And that's why we're so aggressive with prescribing this class of medications. Statins reduce your LDL, reduce cholesterol synthesis, increase the disposal of LDL, which again is the bad cholesterol. They reduce triglyceride levels to a lesser extent. They decrease the uptake of LDL cholesterol into arteries and have a variety of other beneficial effects. Well, how do you know if you're successful? Well, success varies with age. At age 3, it's not wetting your pants. At age 12, it's having friends. At 20, having sex. At age 35, making a lot of money. At age 60, having sex. Age 75, having friends. And then it's back to not wetting your pants. But we in cardiology define success as whether or not we've attained your cholesterol goals. For those with coronary artery disease, we want to get your LDL to 100 or better. For those who are at high risk of heart disease, we look for a goal of 130, and for those without heart disease, the LDL we shoot for is below 160. These are the NCEP, or National Cholesterol Education Program, guidelines. These days, we're actually even more aggressive than that. You might subtract 30 from each of these numbers. And triglycerides and HDL levels have similar targets. Now, what can you do to try to prevent heart disease? Well, behavior is one of the most important things. Obviously, smoking is a real critical factor in the development of heart disease. Controlling your weight, exercising, and eating a proper diet can really go a long way to prevention of heart disease. In fact, exercise is really quite important. Studies have shown that 60% of adults get little to no exercise in the United States, and Americans are immobile for 10 to 15 hours per day. The risk of heart attack with being overweight or obese doubles. And the risk is inversely related to the amount of exercise you can get. Now, exercise is helpful in that it reduces the risk of heart attacks and strokes, blood pressure, cholesterol, reduces obesity. It can control or even prevent type 2 diabetes, improve muscle strength and bone mass, and endurance. And there are psychological benefits of regular exercise as well, including an increased sense of well-being, combating depression and anxiety, and improving cognitive or memory function. Now, how can you exercise? I like to tell my patients that a good